Buddy Carter from the great state of Georgia. He is the only pharmacist in Congress and a member of the House Energy and Commerce Committee. And after a marathon 27-hour debate, he voted yes to advance the health care bill. Good evening, sir.
Good evening.
As I understand this GOP bill, is that it gives people really more of an option. You don't have to buy health insurance. But here, and this is sort of an extension of what I asked Senator Shaheen, if someone opts not to buy health insurance, thinks he's going to live forever, doesn't want to spend the money, or doesn't have the money, if that person gets profoundly ill and shows up at an emergency room, somebody's got to pay. And so what is, under the GOP bill, who pays for that?
Well, obviously, there are laws in place. The Supreme Court has ruled on that, and we all understand that that is a situation that exists. But our feeling is simply that, listen,
so
the free market works. We understand that the free market works.
But so who pays, though? Because, I mean, like, if you lived in a community where, you know, let's say that for whatever reason, a lot of people are showing up at the emergency room, and the bill is going up high, I imagine either the hospital has to pay it, or the taxpayers have to pay it, or the insurance premiums of those who have goes up. I mean, somebody has to pay. So to the extent that that some people are off insurance, it's going to have a greater cost to those, I assume, who are on insurance.
And listen, Greta, that's the same situation that exists today. When someone shows up in an emergency room and has a heart attack and has to get treated and they don't have insurance, then we all pay. You're absolutely right. That's no different from what it is today.
Except, I guess the difference is, and I don't know how many people comply with the mandate under the old system, and I'm not advocating any of these systems, I'm only challenging everybody who shows up about it, is that at least, I mean, with the Obama theory of a mandate that's required, you didn't have these people who could sort of opt out of insurance and have so many people uninsured.
Well, I think just the opposite is true. I think if you had choices out there, I think if you had competition where you had insurance companies that are competing for your business, I think more people would be in the insurance market, and I think more people would be involved and would have care and would carry insurance. You know, Obamacare has created two classes of uninsured. One class is people who have insurance, but they can't afford a deductible, so they don't use it. Another class is people who used to have insurance but can't afford it now, so they don't have it anymore.
Is the GOP bill truly a replacement bill, or is it sort of an amendment to Obamacare? I mean, I guess that's sort of one of the criticisms that Senator Rand Paul has, that it's Obamacare light. But is it not sort of an amendment of Obamacare bill?
What it is Obamacare gone. That's what it is. It's not Obamacare 2.0. It's not Obamacare light. It's Obamacare gone. The days of mandating to people that you must have insurance, and that insurance is what we in Washington, D.C. deem to be the best for you, those days need to be over. People need to have control over their own health care. People want to be empowered, and that's what we want to do, is to give them control over their health care, to let health care be made by patients and physicians, not by some bureaucrat in Washington, D.C. who is mandating and telling them what they need.
I totally understand that, but I'm just not convinced that everyone's going to be. I mean, I think when issues of health care, I'm not sure we all make the wisest decision. I mean, some people smoke cigarettes. I think that's a really lousy idea. But I also think, you know, if you have your choice, if you're young, you feel healthy, you think, like, why should I buy insurance? I'll buy it later and pay that 30% penalty that the GOP bill has built into it. So I'm not so sure people will truly be flocking for this good thing to buy insurance, and when they don't, and then they get profoundly sick, the rest of us pay because they didn't pay into it.
Well, again, that's the same situation that exists now. Yes, you're right. Somehow we need to address that situation. And I think if we have a vibrant, competitive market where people have choices with insurance, that will solve a lot.
I just don't think that's going to change people's motivation. I don't know why. Maybe, I mean, I hope you're right, because look, I've seen, you know, a lot of I've been in hospitals a lot. I've seen how much people suffer. I want people to have access in medical care. I'm just not so sure that we all make the wisest decision until after we get sick.
Well, I have a lot of confidence in our citizens. I have a lot of confidence in the free market. I can tell you from experience that the free market works. The more competition, the more choices that we have, the better off we'll all be in health care.
Do you like Medicare? Do you think, is that a good bill?
Medicare.
Medicare.
Medicare is an essential program that we have, and we have to have that program. Now, it needs reforming. There's no question about that. But no, we're not really addressing Medicare right now. Now, Medicaid is a whole different subject. One of the worst things that Obamacare has done has been in the Medicaid expansion program. Medicaid is a safety net. It is meant for the aged, blind, disabled, for children, for mothers. It was never meant for able-bodied adults. If you look at Obamacare, it's added 20 million people into the insurance rolls. 3/4 of those have been through Medicaid expansion onto a program that was never intended for able-bodied adults, but instead was intended as a safety net.
Whether we go back to whether or not what choices people make. I actually think Medicare has been a great bill, a great program, and just needs to, we need to fix it.
Absolutely.
Anyway,
but it does need some reforms, but yes, it is a great program.
A good model. Anyway, thank you for joining us, sir.